I was waking up a lot at night. Didn't know why. Would get up and go to the bathroom thinking that this is probably why I'm waking up so many times, but it was getting to be about 7 times a night. My husband had been telling me I'd been snoring, and I kept telling him it was him, of course, and and I do realize that it probably was me too. He would tell me that I would be choking at night, and I didn't realize that. So when I told my family doctor that, she recommended the sleep studies. They did the sleep study and found that I would stop breathing about 18 times in an hour. And that was a lot, so they considered that moderate, mild to moderate, and recommended the CPAP. They put me on the lowest setting that you could tolerate, and it still felt like too much. If you've never seen one, it's quite a spectacle. It's a machine. It has a humidifier in it, which there again, there's another problem with that in the wintertime because it drips. And you wake up, you feel like you're drowning, somebody's dripping. And it has a hose that comes up and comes over your head, and you look like you should be underwater with it. They're basically designed, or I believe designed, to be used for someone who sleeps on their back. And if you're a person that tosses and turns and sleeps on their side, it breaks the suction, and so then the air blows back into your face, wakes you up. And some nights it can be your best friend, and other nights it's your worst enemy. I was really becoming intolerant to the CPAP, and it was cumbersome to carry. It's a machine, and you have to carry it. And we travel periodically, so it's not fun to carry something like that through the airport. And also have to wear it when you're somewhere else. I would not use it weekends. I would not use it when we went on vacation. We have a camp on the lake, and I did take it there a few times, but that's really a pain dragging that in and out all the time for weekends, so I wouldn't take it. So I didn't sleep as good and would be tired Monday morning. So after 3 years on that, I was in Dr. Clark's office one day, and I saw some brochures on the front desk, and I picked it up and started asking questions. I'd never heard of anyone else who'd been on anything like that, and so he asked me to bring in a copy of my sleep study, and I did. And I said I'd like to try it. They took their time, they made accurate impressions and measurements, and from the very beginning it was such a relief. It was just so much easier than the CPAP that I couldn't go back now after using the SomnoDent. No noise, so portable. I can sleep on my back or on either side. It makes no difference. Like I said, it's just so much easier. The SomnoDent works for me.